Hello, awesome staff of the Northwest Kidney Center, with standard acknowledgement of the Kent Northwest Kidney Center as the finest dialysis unit in the world. But also a shout out to Amy at the Panther Lake Northwest Kidney Center unit for providing me some of the information for this talk. Welcome to the inaugural 2025 Summer in Service of the Northwest Kidney Center. Today, we're going to talk about antiseptic use at the Kidney Center because we are introducing a new antiseptic protocol on June 30th, 2025. Because it is summertime, we only have two objectives. One, be familiar with the types of antiseptics used in dialysis units and understand the new Northwest Kidney Center antiseptic protocol. The word antiseptic comes from the Greek apti or anti, meaning against, and septikos, which means putrefactive or decay, so against decay. An antiseptic is an antimicrobial substance that is applied to living tissue, usually skin, to reduce the possibility of infection, sepsis, or putrefaction. It's to be distinguished from disinfectants. Disinfectants are chemicals that are applied to inert substances like a countertop or a doorknob or uh, a dialysis chair or a machine, specifically to destroy microorganisms found outside of the body on non-living objects. And of course, we also have antibiotics, which another way to kill bacteria, but they are internalized and they destroy bacteria within the body. Some antiseptics are germicides capable of destroying microbes, so we call them bactericidal. Other are what we call bacteriostatic, so they only prevent or inhibit their growth. Examples of antiseptics, particularly those used in dialysis units, include alcohol, chlorhexidine gluconate, and iodine. Other examples include hydrogen peroxide and sodium hypochlorite solution or bleach. Antiseptics have a long and fascinating history. It all began in ancient Greece with Hippocrates, who was a Greek physician and surgeon who lived from 460 to 377 BC. He's known as the father of medicine, and he used vinegar to irrigate open wounds and wrapped dressings around wounds to prevent further injury. Specifically, he washed ulcers with wine and dressed them with fig leaves. He was followed in ancient Rome by Galen, a notable Roman surgeon who was the first to recognize that pus from wounds inflicted by the gladiators preceded wound healing. But their discoveries were lost in the Dark Ages, during which period all the advances that we had achieved in wound care for surgery and healing wounds by Hippocrates and Galen were lost after the fall of the Roman Empire. Only be rediscovered in the medieval ages, at which time physicians had different ideas regarding wound healing. Hugh of Lucca, Theodoric of Servia, and Henry de Mondeville were opponents of Galen's opinion that pus was important to healing. Instead, they advocated draining and cleaning the wound edges with wine, dressing the wound after suturing, and leaving the dressing on for 10 days while soaking it in warm wine. Despite their discoveries, prior to the mid 19th century, limb amputation was associated with an alarming 50% postoperative mortality from sepsis. But all that changed because of the work of Louis Pasteur. He was a French scientist who specialized in chemistry and microbiology. And in 1861, he published the germ theory, arguing that bacteria were the cause of disease. Initially, the medical community wasn't excited about Pasteur's ideas, but one young visionary, Joseph Lister, who was an English surgeon in London, took Louis Pasteur's discovery that tissue decay was caused by microscopic organisms, and he theorized that the spread of these microbes through surgical wounds was responsible for death in the postoperative period. In 1865, Lister began treating wounds with carbolic acid in an effort to prevent tissue decay and the resulting infectious complications. As a result, the incidence of surgical sepsis fell dramatically, and this catalyzed the adoption of modern aseptic techniques, including instrument sterilization, the use of surgical scrub and rubber gloves, and sterile patient preparation. In 1879, Listerine was developed as an antiseptic mouthwash product by Joseph Lawrence, who was a chemist in St. Louis, Missouri. He named it after Joseph Lister in honor of his contributions to the practical application of the germ theory. Listerine includes alcohol, menthol, methyl salicylate, and thymol. It was promoted initially with the slogan, "Kills the germs that cause bad breath." In 1895, Listerine was promoted to dentists for oral care. In 1914, it became the first over-the-counter mouthwash sold in the United States. In the 1920s, it was pitched as a solution for bad breath. In 1927, the company briefly marketed Listerine cigarettes. And between the 1930s and 1950s, the company advertised that it would prevent dandruff if applied to the head. And between the 1950s and 1980s, it advertised that it would prevent the common cold. Listerine was also used at one point by surgeons to clean the skin before operations. It has since fallen out of favor for that purpose, replaced by modern day antiseptics, the ones that we use in dialysis units. Common antiseptics used in dialysis units include alcohol, iodine, and chlorhexidine, not to be confused with the most commonly used disinfectant in dialysis units, which is sodium hypochlorite or bleach, what we use to clean the dialysis chairs and the dialysis machines and countertops. Alcohol-based solutions typically contain either ethyl alcohol or 70% isopropyl alcohol. These are very effective antiseptic agents. They are fast and short-acting. They have broad-spectrum antimicrobial activity and are relatively inexpensive. Isopropyl alcohol is a colorless, flammable organic compound with a pungent alcoholic odor. More than 1 million tons are produced worldwide annually. It was first synthesized by Alexander William Williamson in 1853 and later produced for something called cordite preparation. Cordite basically is a chemical substance that produces a lot of a high pressured gas that can propel, so it's a propellant, a bullet from the chamber of a gun. So it's basically used for military purposes. But in the medical world, isopropyl alcohol is used in rubbing alcohol and for the purpose of skin sterilization. It has a short bacteriostatic action time, so in dialysis units it should be applied in a rubbing motion for 1 minute immediately prior to needle insertion. You want to insert the needles while the isopropyl alcohol is still active. Isopropyl alcohol is the main ingredient in rubbing alcohol, which was popularized in North America in the mid 1920s, and it was originally used as a liniment or a lotion for massage, and hence the term rubbing alcohol. While a very effective antimicrobial, there is a dark side to isopropyl alcohol. It is volatile and flammable. There are some case reports of operating room fires originating from alcohol-based skin preparation, resulting in significant injury to patients and staff. The flammability can be avoided by allowing the skin to completely dry and avoiding the preparation of areas with excessive body hair, which can delay alcohol vaporization and can also easily catch on fire. Poisoning can occur from ingestion, inhalation, absorption, or consumption of rubbing alcohol. It should most definitely not be applied to mucous membranes. Another broad spectrum antiseptic agent used in dialysis units is povidone iodine. Um, it is a chemical complex of povidone, hydrogen iodine, and elemental iodine. It contains between 9 and 12% of available iodine, and it works by releasing iodine, which results in the death of a range of microorganisms. It was first discovered in 1955 at the Industrial Toxicology Laboratories in Philadelphia by H.A. Shalansky and M.V. Shalansky. It is included on the World Health Organization's list of essential medications. It's sold under a number of brand names, including betadine, and it works by iodinating lipids and oxidizing cell membranes of bacteria with no chance of the development of resistance. The rate of developing a sensitive skin reaction or a rash is around 0.7%. Rashes can manifest as hives or itching or redness of the skin or stinging or inflammation. Iodine can also be absorbed into the body in various degrees, depending on application area and the condition of the skin. Too much iodine can cause hyperthyroidism, so an overactive thyroid gland. Chlorhexidine is also known as chlorhexidine gluconate. Came into medical use in the 1950s. It is included also on the World Health Organization's list of essential medicines. It's available over the counter, sold as many different brand names, including Hibiclens, Chloroprep, Dynahex, among others. Chlorhexidine works by disrupting bacterial cell membranes, sort of like iodine. It has a more sustained antimicrobial activity, however, and is more resistant to neutralization by blood products than either iodine or alcohol, and it's used for hand washing, showering prior to surgery, skin preparation agent, cleaning wounds, preventing dental plaque, and treating yeast infections of the mouth. Potential side effects of chlorhexidine include skin irritation, teeth discoloration when used as a mouthwash, allergic reactions, eye problems if direct contact occurs, and it can potentially be toxic to the ear if placed into the ear canal with a ruptured eardrum. So my advice is to not instill chlorhexidine into the ear canal if you have a ruptured eardrum. Let's now take a look at the Northwest Kidney Center new protocol for site preparation for needle cannulation. So the Northwest Kidney Center is transitioning to 70% isopropyl alcohol as the primary antiseptic, effective June 30th, 2025. Why are they doing this? Well, the official statement is to enhance patients' safety and reduce the risk of skin reactions, and because it's in alignment with current industry standards, i.e., what most other dialysis organizations are doing. My opinion is a little bit different. I think we're using it for two reasons. One, it is an effective antiseptic, and because it is just a lot less expensive than the other two antiseptic agents. So isopropyl alcohol is definitely the most cost-effective antiseptic that we have available. This is a cost estimate as of 2024. Isopropyl alcohol costs anywhere from $1 to $3 for a 16-ounce bottle. Betadine costs anywhere from $6 to $16 per 16-ounce bottle. And chlorhexidine costs anywhere from $16 to $30 for a 16-ounce bottle. So isopropyl alcohol is way less expensive. And, we have to be fiscally responsible in dialysis units. The risk of skin irritation with isopropyl alcohol is moderate. With iodine, it's moderate to high, and with chlorhexidine, it's low to moderate. The mechanism of irritation with isopropyl alcohol, it defats the skin, it leads to dryness, cracking, and irritation with repeated use. Iodine can be cytotoxic, so it's damaging to skin cells and irritating, especially with prolonged exposure. Chlorhexidine is probably the best tolerant with respect to irritation, especially in sensitive, but it can cause irritation in sensitive areas. Common reactions with isopropyl alcohol include dryness, redness, stinging sensation, especially with broken skin. Pretty similar with betadine, redness, burning, itching, occasionally contact dermatitis. With chlorhexidine, you can get some mild irritation, mild itching and redness. Serious reactions are uncommon. There is very low allergic potential. It's higher with povidone iodine, and it's rare with chlorhexidine. According to the new Northwest Kidney Center antiseptic algorithm, we should scrub in a circular fashion for 60% using 70% isopropyl alcohol, with cannulation occurring while the site remains wet to optimize antiseptic activity. So recall that isopropyl alcohol has a short duration of antimicrobial activity. You want to insert the needles when you are confident that it is still actively inhibiting microbial growth on the skin. Betadine swab sticks will be used as an alternative if the patient proves to be allergic to isopropyl alcohol. And recall that you have to let betadine dry for 3 to 5 minutes before inserting the needle. Chlorhexidine will be reserved only for patients who are allergic to both alcohol and betadine, and you have to get a formulary exception. This represents the Northwest Kidney Center's revised cannulation policy. I won't go through all the steps, just want to highlight step 5. Use 2 alcohol pads, clean one side at a time with circular scrub for 60 seconds. Both chlorhexidine and isopropyl alcohol are excellent antiseptic medications. That said, I think we have to be intellectually honest and shouldn't claim that isopropyl alcohol is better or more effective than chlorhexidine. I think data actually support the opposite. Chlorhexidine is effective against a wider range of bacteria. and viruses than isopropyl alcohol. It's generally less irritating to the skin compared with isopropyl alcohol. It has a longer residual effect, provides a prolonged antimicrobial activity, and there's a lower risk of bacterial resistance with chlorhexidine than isopropyl alcohol. And yet, isopropyl alcohol is more affordable and it's widely available. And in this current cost environment where it's very difficult to maintain profitability, it's important that we make decisions that keep the doors open. Let's now brace ourselves for the monthly quiz. Who is considered the father of modern antiseptics? Excellent. That is Joseph Lister. Remember Joseph Lister, he's the physician, the English physician who took Pasteur's idea of the germ theory and applied it to a practical sense. The operating room started using antiseptics and noticed a huge decrease in postoperative infections. Question number 2, this medication was pitched as a solution for bad breath. You got it. What is Listerine? Question number 3, name 3 antiseptics commonly used in dialysis units. That's right. Alcohol, betadine, and chlorhexidine. ABC. What are the major advantages of isopropyl alcohol over chlorhexidine? That's right. Lower cost and wider availability. Final question. Should you insert the needles when the isopropyl alcohol is still wet on the skin or has dried? That's right, still wet. Recall, isopropyl alcohol has a short duration of antimicrobial activity, so you want to insert the needles when you are confident that it is on the skin and exerting its antimicrobial effect. This includes the June 2025 in-service for the Northwest Kidney Center. Thank you all for your attention and for everything you do to take care of our patients. This is Andy Berkelbro signing out until next month. Take care.